Today we're going to dive into a very specific vagus nerve exercise that can not only directly stimulate the vagus nerve, but it can create an improvement in vascularity and hydration of the nervous system that can ultimately influence all of the important aspects of your autonomic nervous system, like digestion and heartbeat and breathing. So please join me in this video. Hi, my name is Dr. Arianne. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, mindfulness instructor, and I'm the owner of the Movement Paradigm Integrative Health Center. And you can check out all of the other vagus nerve exercises on my channel, but today we'll focus on this specific one. So we're going to talk about, of course, the anatomy of the vagus nerve, how this exercise is going to work, and this direct technique that you can use to stimulate it. So the vagus nerve, as we know, is your body's rest and digest superstar, helping your body to calm the nervous system, to regulate stress, to improve digestion. So let's start with a quick explanation of the vagus nerve anatomy, and then we'll guide you through this powerful technique to release tension and directly stimulate the vagus nerve. So as it relates to the anatomy, we want to remember that it is exiting from the brainstem and coming through this jugular foramen. We have branches that are quite extensive because this is the cranial nerve 10, which is 2 cranial nerves, and it is actually going on either side of the body. So it's running from the brainstem to the neck. It branches into the ear, the chest, and the abdomen. We have our right branch, and we also have our left vagus nerve branch. The right vagus nerve branch is going to travel through the neck and it's actually looping around the subclavian artery, and it works its way behind the root of your lung. So it primarily innervates the posterior or the back of the abdominal organs, including the stomach and the intestines. The left vagus nerve is going to take a slightly different route. So it loops around the aortic arch before traveling to the chest and providing innervation to the front of the abdominal organs. So of course, both nerves are going to play a huge role in pulmonary, cardiac, esophageal plexi or plexuses, which is our nerve networks, and it helps to regulate breathing, heart rate, and digestion. So when we can decompress the thoracic inlet, which I'll show you in just a moment, this is where the vagus nerve is going to pass through near the collarbones. You can stimulate these branches to help balance your nervous system. Okay, are you ready to get to it? So what I'd love you to do is to find a position where you can comfortably lean into something. So we're going to take our thumbs and we're going to bring them on either side of our collarbone. So from here, we're going to first just kind of settle into the position. So we want to kind of think that this thumb as flat as you can make it. I recognize that's a little challenging, but let's just try our best to keep a flat thumb versus a pointy thumb. But again, try your best. Everyone's anatomy and mobility is different. From here, we're going to rest my elbows just on the desk here. I'm going to just gently lean into the position. As I lean in, I'm actually just starting to gently lift the collarbone. And this is where the magic happens. So from here, as I lift the collarbone, I'm going to start to feel like my collarbones are just floating. So we're just kind of like hanging out. And again, you have to let your weight of your body really settle into this. When you feel like you're getting more comfortable with it, then I'd love for you to just think of bringing your thumbs out towards your shoulders. So you don't necessarily need to move the thumb, but you are instead just kind of tractioning that tissue out. So I'm already getting a pretty significant parasympathetic response. So you may get a sigh or a swallow or a yawn, and still hang out here a little bit longer. So we want to hang out for maybe about 1 to 2 minutes. So in that range, and just kind of settling in. We can even do some gentle circles. So I can kind of do a little circle with my thumb here, still kind of tractioning that tissue out. And again, like I'm really swallowing, having a, again, significant parasympathetic response. So you may or may not. So give yourself a little bit of time, but we really ultimately are directly stimulating these branches. So it's such a powerful technique. And when you're finished, we really want to come out of this nice and gentle. So kind of just come up to this seated position, just kind of ease into it. And of course, always respect and honor whatever comes up, and make sure that you're just taking a moment to do some diaphragmatic breathing. We know that that in and of itself is going to stimulate the vagus nerve. And while you're in the position itself, you also want to be doing slow, deep breathing. That's going to stimulate of course, this parasympathetic response, stimulate the vagus nerve, create a release of acetylcholine, which influences this relaxation response. You're also creating, like I said, a lot of blood flow and vascularity. You're influencing the lymphatic system. We have so much lymph here. And you're again creating this direct stimulation of the vagus nerve. So it's a really, really powerful exercise. So if you feel like there's any potential contraindications, please check with your medical professional. And otherwise, I hope you enjoy the technique. If this was helpful for you, I would love to give it a like, give it a share, of course, with someone who might need it. And of course, check out all of our other videos on vagus nerve exercises. There's so many. There's probably hundreds at this point to help you navigate your nervous system. And just think as we're doing that, we're essentially toning our nervous system. So we're allowing, teaching our body how to be resilient to life stressors. If we want to use the analogy of strengthening a muscle, we're not necessarily strengthening the nerve, but we are improving the capacity for us to be resilient in day-to-day life. So hope you enjoy. As always, thank you so much for being here. And please make sure if you need help on your own journey to reach out to us directly. You can go to our website. You can also check us out on our app. So the Movement Paradigm app on Apple or Google. And there we have so many different programs. We have challenges every other month. Lots of ways for you to access whole body health. Thank you as always. Until next time.